Welcome to Unit 2, Lesson 1, where we will talk about the treatment of children with intellectual disabilities. And the verse guiding this lesson is from Romans chapter 12, verse 16. Live in harmony with one another. Do not be proud, but be willing to associate with people of low position. Intellectual disabilities are pretty common, especially in lower and middle income countries. In many cases, they can be prevented. Children with intellectual disabilities are often stigmatized and excluded. Intellectual disabilities can range from a spectrum of mild impairment to severe. Treatment is provided to individuals and families through services in the school as well as in the home, and early intervention to optimize development is critical. It's important as providers to identify developmental delays early on and provide referral to specialists. Families caring for children and adolescents with intellectual disabilities have a high level of caregiver stress and certainly are at risk for burnout. These children are vulnerable populations and can be at risk for abuse or neglect. And so adequate access to services is crucial. The term intellectual disability has replaced the term mental retardation that was used in earlier versions of the DSM, starting in the DSM 5. Intellectual disability is defined as a condition of arrested or incomplete development of the mind, which is especially characterized by impairment of skills that are needed during the developmental period that can contribute with overall level of intelligence, which includes cognition, language, motor, as well as social abilities. The American Association on Intellectual and Developmental Disabilities describes intellectual disability as being characterized by significant limitations in both intellectual functioning as well as in adaptive behavior and in social and practical adaptive skills. The disability must originate before the age of 18. There are different levels of impairment or classifications for intellectual disability that correlate with the IQ. And we see here that mild intellectual disability would be considered an IQ of 50 to 69, moderate 35 to 49, severe 20 to 34, and profound under 20. Borderline intellectual functioning is identified as an IQ between 71 and 85. While 70 may be considered normal, individuals with a borderline intellectual functioning can have difficulties assimilating in various ways, and it's estimated that 7% of the population may fall in this category. IQ, or intelligence quotients, is a score derived from one of several different tests. The Wechsler Intelligence Scale for Children, or the WISC, is one of the most commonly used and well known, but there are many types. The mean or average score is determined to be about 100 with a standard deviation of 15 points. So 95% of the population have scores within 2 standard deviations of the mean. so within an IQ range of 70 to 130. For the IQ to be accurate, it needs to be standardized against a population that is culturally similar to that being tested. This table illustrates the attainment in adulthood of people with different degrees of intellectual disability. You can see that even those with severe intellectual disability can become at least partially independent and look after themselves if they're provided proper supervision, care, and training. Profound IQ is usually below 20, and it accounts for only 1 to 2% of all cases. These individuals cannot take care of themselves and often are nonverbal. Their capacity to express emotions is limited as well. Seizures, physical disability, and reduced life expectancy are common here as well. Severe intellectual disability between 20 and 34 accounts for about 3 to 4% of all cases. And every aspect of their development in the early years is usually distinctively delayed. They often have difficulty pronouncing words with a very limited vocabulary. Through considerable practice and time, they can gain basic self help skills, but are going to need support at home, school, and in the community. Moderate intellectual disability is usually between 35 and 49 and accounts for about 12% of all cases. They are slow in meeting intellectual developmental milestones, and their ability to think and learn is impaired. But they are able to communicate and look after themselves with some support, and with supervision can perform unskilled or semi skilled work. Mild IQ is usually between 50 and 69, and that accounts for 80% of all cases. Development during early life is slower than normal children, and developmental milestones are delayed. However, they are often able to communicate and learn basic skills. Their ability to use abstract concepts or to analyze and synthesize information can be impaired, but they can achieve reading and computing skills to the grade level of about 3 to 6th grade. They can perform housework, look after themselves, and do unskilled or even semi skilled work. They do usually require some additional support. The etiology of intellectual disability is heterogeneous. Injury, infections, and toxins have become less prevalent causes due to the improvement in prenatal care, but genetic factors have become more prominent. While no specific etiology can be found in up to 40% of cases, particularly with mild intellectual disability, environmental influences such as malnutrition, emotional and social deprivation can aggravate intellectual disability as well as cause it. Understanding the etiology of intellectual disability raises the possibility of treatment and even prevention in some cases. Many factors have been confirmed to cause or be associated with intellectual disability. These factors include influences on the development and function of the child's brain prenatally, as well as perinatally or postnatally. And it can be divided into three groups: organic, genetic, or sociocultural. Trisomy 21 and Fragile X are the commonest diagnosable genetic causes of intellectual disability. Compared with typical children, children with intellectual disabilities are at a higher risk of having additional health problems. The most prevalent health conditions are epilepsy, cerebral palsy, anxiety disorders, oppositional defiant disorder, as well as autism spectrum disorder. And these are some of the most commonly associated conditions with intellectual disability. Down syndrome, or trisomy 21, which has a risk that increases according to maternal age. Fragile X, phenylketonuria, congenital hypothyroidism, and fetal alcohol syndrome. Congenital hypothyroidism is an endocrine disease caused by thyroid hormone deficiency after birth. It can be permanent or transient. Permanent congenital hypothyroidism is usually associated with thyroid dysfunction or deficiency of thyroid stimulating hormone, while transient congenital hypothyroidism is due to an iodine deficiency, or it can also occur from maternal intake of antithyroid drugs as well. Congenital hypothyroidism is diagnosed by measuring serum TSH and either free T4 along with T3. And according to age reference ranges, primary congenital hypothyroidism is confirmed with an increased TSH. Secondary congenital hypothyroidism is likely if the T4 is low, but the TSH is not elevated. The typical appearance of a child with hypothyroidism includes a wide posterior frontal puffy face, flattened nose, and eyes exhibiting pseudo hyperthyroidism and an open mouth. If untreated, congenital hypothyroidism can result in growth failure, permanent mental retardation, and cardiac problems. Newborn thyroid screening tests and early management are very important. Blood sampled from a heel prick between 2 and 5 days of age is typical to monitor for this problem. Fetal alcohol syndrome is another preventable cause of intellectual disability. Fetal alcohol syndrome is the result of high alcohol consumption during pregnancy, especially in the first 3 months. Here is a image depicting some of the usual hallmark features of a child with fetal alcohol syndrome. According to the DSM, there are three basic criteria to meet a diagnosis of intellectual disability: significant sub-average intelligent functioning, or an IQ of 70 or below, as well as impairment in adaptive functioning, and the onset must be before age 18. Assessment to provide a diagnosis in this area includes an interview and a review of family medical history, the pregnancy, development, and environment exposures, as well physical exam, IQ measurement, and developmental screening tests. Lab or genetic testing can be very helpful as well. The WISC is the international standard for assessment of IQ, though is not the only test, as we discussed previously. The Denver Developmental Screening Test, or the Denver 2, has a similar scale to assess general development of preschool children. It's important to ask about academic functioning in older children as well. Screening using the heel prick test is routinely done, although not mandatory, to detect rare genetic disorders in infants after birth. It usually screens for phenylketonuria, primary congenital hypothyroidism, or cystic fibrosis. Differential diagnoses include any sensory difficulties, such as hearing impairment or visual impairments. And it is important to try to identify any possible underlying cause of the intellectual disability, as some of them may be reversible. So, certainly identifying any infection, a neurological disorder, an endocrine disorder, and checking family history. Um, any sudden regression or loss of skills that were once mastered should be treated as a medical emergency. Additional differential diagnoses include the experience of abuse or neglect, as well as developmental disabilities or learning disorders. Autism can occur with or without intellectual disability. Caregiver stress is a major priority. And so be sure to check in with the parents' mental health status. Always check how they're coping. Depression in mothers is very common. Severe marital discord or the experience of domestic violence, divorce is important to consider. Raising a child with intellectual disability is hard. How are the parents doing? Do they need some couples therapy or assistance with the relationship? One parent can often blame the other and or withdraw. Bullying is another area that needs to be identified, as these children can often be victimized.